So for the flu vaccine, we've known for decades and decades that flu is more severe in pregnancy. The 2009 pandemic, we found that pregnant women were about 6 times more likely to die of the flu than other people that get the flu, other young, healthy people. So the advantage of giving both vaccines during pregnancy is you have a period of protection for the baby. The mother will make antibodies to whooping cough or to influenza. Well, you want those people, the grandparents, the dad, the caregivers, all to be up to date on their immunizations. Healthy young people in their 20s or 30s that might be having children, probably have never had a serious case of the flu before, and you're so much more vulnerable when you're pregnant. I think that's news to a lot of pregnant women. And so I really want you to get the flu vaccine during your pregnancy. It protects your pregnancy from complications, it protects your own health, and protects the health of your newborn. So for the flu vaccine, we've known for decades and decades that flu is more severe in pregnancy. The 2009 pandemic, we found that pregnant women were about 6 times more likely to die of the flu than other people that get the flu, other young, healthy people. So the advantage of giving both vaccines during pregnancy is you have a period of protection for the baby. The mother will make antibodies to whooping cough or to influenza. Well, you want those people, the grandparents, the dad, the caregivers, all to be up to date on their immunizations. Healthy young people in their 20s or 30s that might be having children, probably have never had a serious case of the flu before, and you're so much more vulnerable when you're pregnant. I think that's news to a lot of pregnant women. And so I really want you to get the flu vaccine during your pregnancy. It protects your pregnancy from complications, it protects your own health, and protects the health of your newborn.
We would like to end our conference this year with some powerful personal stories about vaccinations and the impact that vaccine-preventable diseases have had on their lives. This content may be difficult for some people. Please understand that it is okay to step away, take a break, and return when you are ready. Our presenters will be Karen North, a cervical cancer survivor, Katie Van Turnout, 2015 CDC Childhood Immunization Champion, and Sonia Satterwhite, who will be discussing her experience living with COVID-19. Thank you so much for joining us and for sharing your stories.
Hi, thanks for joining me today. My name is Karen North. I am an RN for 31 plus years. I am also a cervical cancer survivor. In 2016, I was diagnosed with adenocarcinoma of the cervix and was scheduled for a radical hysterectomy. And when I went in for the radical hysterectomy, my cervix tumor had actually grown over 1 centimeter in 1 month. So instead of a radical hysterectomy, I had chemotherapy and radiation. Chemotherapy was for 6 rounds. Radiation was 25 rounds of internal, 6 rounds of external. I now have the lasting effects of radiation, such as radiation colitis, lymphedema, the psychiatric effects of having cancer. And for the longest time, I felt that it took the RN part of me away, and it broke my heart. Through therapy and through support, I now realize that yes, I am still an RN. I may no longer be practicing in the field, but I still am educating and encouraging people to understand the side effects, the risks, and the benefits of completing your preventive health screenings. Again, like I said, in 2016, I went in for my routine well woman exam. At that point, my doctor asked me if I had ever had an HPV test, and I said no. So we did the Pap test and the HPV. That is when the abnormal cells were shown. I'm here to encourage you to vaccinate for HPV. The HPV vaccine is available from ages 9 until 45. It is the only vaccine that we know that is available that can prevent cancer. HPV can cause 6 different types of cancer. Like I said, cervical. It can also cause vaginal, vulvar, oropharyngeal, penile, and anal. So it's very important to encourage people to get vaccinated. If they have questions, please answer them. It's so important to encourage our patients, their parents, their significant others to vaccinate for HPV. The HPV vaccine is the only vaccine that we know that prevents cancer. When you're educating your patients, tell them. When you're seeing your patients, it's important to tell them that you need to schedule their HPV vaccine. Up until somebody the age of 15, it's only 2 vaccinations. After the age of 15, it's 3. The side effects, sore arm, generally feeling kind of cruddy. No different than most every other vaccine that is out there. It's important for providers that offer sports physicals to ask about had they received the HPV vaccine. I myself, as a mother, did not know that the vaccine was available for males because my son was seeing sports physicals. And had I known, I would have gotten him vaccinated before the age of 26. And I can't encourage people enough and important it enough that preventative health screenings. That means mammograms, colonoscopies, pelvic exams, Pap test, HPV test, doing a co-test. My cervical cancer was found on routine health screening. And honestly, had I not had my routine health screening, I wouldn't be here today. On top of that, in 2014, I was diagnosed with early stage breast cancer off of a mammography. I'm here again to educate you and encourage you to be proactive. If you have a patient that has questions about the vaccine, please be honest with them. There's information out there on how to explain the vaccine and its benefits. There's information on what to say to parents. what to say to the teenager, the adult. It's also important that if you see somebody that has an abnormal pelvic exam, please don't hesitate to reach out to gynecology, gynecological oncologists. They are the experts, and they are the ones that are treating these patients that are just like me. Also, encourage your patients to get their dental exams. And again, check the back of their throat, check their tongue, check their tonsil area, check those lymph nodes. Oropharyngeal cancers have just exploded in diagnosis over the years, and those also have forever lasting effects. It's important to know that going through radiation has dramatically changed my life, where I have lymphedema of my right leg, my left thigh. I have to wear compression every day. And believe you me, it is no fun putting those hose on. I also have the side effects within my colon, whether it's radiation colitis and have to go on antibiotics for that, whether it's just food intolerance, just general days where I have no energy, and the emotional psychiatric side effects. Be honest with your patient. Encourage them to seek therapy, counseling if they've been diagnosed with cancer. The HPV vaccine is the only vaccine that we know can prevent cancer. It's been available since 2006, 2009, and it's simple. It's a no-brainer. Prevent such a deadly, cruel cancer disease. I'm here to empower and advocate people to go to the preventative health screenings, to get vaccinated, to ask questions, to encourage themselves that if they don't find an answer that they're comfortable with, to seek out a second opinion, a third opinion, a fourth opinion, whatever it takes. Not everybody's personalities match. And when it comes to the C word, it's more important that that connection is there, that open, honest communication is there, and sitting down and actually listening to your patient. I can tell you that from personal experience, the very first day I met my gynecology oncologist, we made the absolute perfect connection. I was already dressed for a pelvic exam. I happen to have a partner whose name is Karen as well. And when he's like, okay, I'm going to call you Karen 1, Karen 2. No, Dr. Leibarger, you're going to actually mess that up. And he stepped back and he said, I'm going to call you Karen dressed and call you Karen undressed. I take the name Karen undressed to heart and absolutely love it. Actually, when I call the office, half the time, I don't even say it's Karen North. I usually tell them it's Karen undressed. And it's great. It's one of those things to give me a laugh, give him a laugh. And again, it's that honest, open communication. The forever side effects of cancer are the reason that I advocate. I don't want anyone else to go through what I've gone through. I don't want to lose any more friends. I don't want people to lose their fertility at the age of 18, 24. What heartbreak that people go through. I am also an ambassador for an online support group that is available, and that support group organization is Survivor, that starts with a C, CERVIVOR.org. We are here to empower, advocate, and support other cervical cancer survivors, other cervical cancer patients, their friends, and their families. We're available, like I said, online. We're also available on Facebook, Instagram, Twitter. You're more than welcome to reach out to me personally. My email address is karen@survivor.org. You can also email info@survivor.org. We're available on Facebook as Survivor. We have a private Facebook page for those that have been diagnosed with cervical cancer. And through that private Facebook page and the organization is how I learned that I wasn't alone. That's how I found my voice and was able to share my story with you again today. I am honored to be a part of the Missouri Immunization Coalition, to share my story again, offer information, offer my connections to other providers, to other patients, whether it be about asbestos and lung cancer, radon, lung cancer, HPV. It's so important to know why we need to advocate for our patients, educate our patients. It's also important to know that there are so many people out there that don't have good access to health care, and we need to do better. We need to educate and explain things, and we need to do better. We need to educate and advocate for our patients. We need to have an open communication with our patients. We need to let them know that they can ask us anything. So many times patients can be embarrassed or uncomfortable to ask that one question. That one question can save their life. That one moment can forever dramatically change not only their life, their family's life. I will say that my family has forever changed in relationships and their aspect to everyday living. I also want to encourage people that do sports physicals to not just have the checkmark form of, is your child up to date with their vaccines? I didn't know that the vaccine was available for males. And at that point, had I known, I definitely would have already had my son vaccinated. I didn't know until he was 26. Luckily, at that time is when the age increased to the age of 45, and I can say proudly that he is fully vaccinated for HPV. There's a lot of misinformation, as we all know, about vaccines. And when the HPV vaccine first came available, so many times it got connected with sex. Is this going to encourage my child to have sex or give them permission or encourage their promiscuity? Again, sadly, we don't know when somebody's first exposure to HPV will be. 80% of the population has been exposed, and multiple of those have cleared that virus on themselves. Even if you have someone that has been diagnosed with an HPV-related cancer, definitely consider about giving them the HPV vaccine. It covers 9 viruses. They might not have been exposed to one of those certain viruses, and you can prevent them through going through that. I encourage you to ask me any questions. I'm going to stay here and be available online to answer anything. And again, you can email me, you can email Survivor, and I'll do whatever I can, because I don't want anyone to have to go through what I went through, and I don't want anyone that has been diagnosed with cervical cancer to ever feel that they are alone. Thank you again for letting me join, and I encourage you again to reach out to me, and I look forward to hearing from you soon.
Hi, so I'm Katie Van Tornhout, and I am Callie's mom. And Callie was our firstborn daughter after 5 miscarriages and 5 years of trying. And she was the perfect baby. She thrived. She was a preemie, but she was feisty in the NICU. She came home after 12 days, and after 15 days at home, she developed a cough. And not like a heavy gasping cough. She coughed like a toddler mimics their parent. We took her to the doctor's office, and they said that it was just a cough and would take its course and be gone. 2 days later, on a Wednesday, she went in for another checkup, and she stopped breathing in my arms. She turned blue. All the nurses, doctors ran to our bedside, and an ambulance was called. They took us by ambulance to the hospital and admitted her almost immediately to the PICU. It was a lot of testing, a lot of unknowns for 2 full days. They tested her for pertussis. They tested her for meningitis. And they told us to bunker down for the weekend because it was going to get worse before it got better. So my husband and I, we moved into her room. We didn't leave. We were at her side the entire time. On Saturday morning, around 12:45, they came in to do a respiratory therapy on her. And when they laid her back down from the session, they couldn't get her comfortable. She was squirming. She was turning colors. And at 1:17 in the morning, they said they couldn't do anymore, and she was gone. Our brand new baby, who we longed so hard to get, was gone. And it was, ironically, on Monday, February 1st, which was her actual due date, that the CDC called us at home and told us that she tested positive for pertussis, which is whooping cough, which in my eye, as a new mom, I had no idea what that was. I had no idea it was still even around. And at that moment in time, my world collapsed. Like, I felt like this was something that shouldn't happen to anybody's child, let alone mine, who we longed for so long. We spent 3 weeks doing absolutely nothing. We entered a really dark world. And then we received a phone call from Vaccinate Your Family that wanted to share our story. And with that, we decided to do our own research and realize this could have been prevented. That new parents should be vaccinated against whooping cough to cocoon those babies around them. That hospital staff should be boosted for the same thing. And when we went back to the hospital and asked these questions, it wasn't a recommendation at that time for pregnant moms to get the booster. It became after the fact that she was gone that it was kind of pushed and changed. And our hospital didn't have that requirement for nurses either. And it turns out that a nurse in that NIC unit was carrying pertussis and wasn't aware. So how many other babies could have been infected, we have no idea. With that, we decided to make it change. We don't want any other parents to go through what we've gone through, to have to welcome a baby and then bury a child. It's the worst feeling in the world. So we became advocates to spread the word, not just about Callie's story, but about the need for vaccines and the booster for TDap especially. Anybody that comes around your baby should be boosted, whether it's your grandparent, a babysitter, the mailman, anybody that comes within like 6 foot of that baby, vaccinate them. We let nobody in our home for 4 months when we had our rainbow baby. After that, we didn't go anywhere. We protected her as much as we could. Unfortunately for Callie, she was too young to have her vaccines. So it was even more crucial for all those around her to be vaccinated. If I could change it now, I would have done everything in my possible power to save her. But it wasn't a recommendation. And it is now from the CDC. And I just want everybody to realize that had that been a recommendation prior to that, she could still be here. I could have my baby. And instead, I have to share her story with all of you in hopes that you'll look at Callie's story or hear her story and want to protect those other babies that don't have that protection. I mean, they don't get their booster, babies don't get their shots till 2 months of age. So for that first 8 weeks, it is so critical to keep them safe because who knows what anybody else around you is carrying. In this day and age, it could be the flu, it could be a cold, it could be pertussis, it could be COVID. And without all these boosters and vaccines, those babies are vulnerable. And I don't want any parent or grandparent to go through the hurt that we had. We still have that pain. I have welcomed 3 babies into my life since her passing. And all 3 of those kids of mine have every shot they could possibly get. I'm afraid. And I don't want my family to be passing something on to somebody else's family unknowingly. If I could save your child, I will do everything in my power to save your child. And I'll do it in Callie's name. And I don't want parents to ever know this pain. And that's my biggest fear because nobody should lose a baby for any reason. You don't go through this stage in your life, and they don't teach you this in the parenting books of how to grieve a child. And it's been 12 years, and I still feel like it was yesterday. She's with me wherever I go. I feel her spirit's there. I feel like when I speak about her, she's hugging me from behind, just saying, Mom, you're spreading my word. And her voice isn't here, so I have to be her voice. And you have to be her voice as doctors and nurses and caregivers to spread the word to all those people who are hesitant or question it and share her story, share her picture. I mean, she was a healthy baby, and now she's not here because of one person who wasn't vaccinated correctly.
My name is Sonia Satterwhite. I grew up here in Columbia, Missouri. I'm married and have 3 children. I work as a registered dietitian at WIC, Women, Infants, and Children, so I'm in public health. And I also am a campus minister with InterVarsity. I get to welcome and support international students at Mizzou. And when 2020 came and we were hit with the pandemic, we felt like it was an opportunity to love our neighbors as ourselves and to care for those around us. Even if I wasn't high risk, I was very healthy, fairly athletic. I was still running regularly. So when in September 2020, when I tested positive, I wasn't really very scared, but I wanted to be careful not to pass it along to anyone else. We still don't know for sure how I got it, but I was around someone who was asymptomatic but positive a couple days before that. So I found that out later, but still unknown for sure how I got it. I had a sore throat, headache, some body aches. Wasn't too bad. I isolated even from my family. And actually, no one else in my family got it at that time because I isolated. And I did continue to have some more symptoms, shortness of breath, just very tired. It definitely seemed worse than anything I had really had before. But I did not have to be hospitalized. After about 5 days, I was even feeling a lot better and even more energy. I would learn later on that COVID really is just such an up and down journey. And so at about day 17, I started having chest pain. Went to the emergency room. I'd never had anything like that before. Everything checked out okay. And so I went back home, but I continued having chest pain. And that was just the beginning of many strange symptoms, which for me became mostly neurological. I had internal tremors and just all over pain, joint pain. It was the beginning of October. So about a month post-COVID, I started having just these tremors where I'd lost control of my arms and my legs. And still, we don't know what caused that. Thankfully, it was just that one episode. But then I continued to have what felt like these internal tremors or tingling in my arms and my legs. Dizzy spells, tachycardia. It was difficult to find help. I saw, I think, 14 different specialists in the last couple years. I probably found the most help from a post-COVID clinic in Memphis. And there's also, I want to note that there is a post-COVID clinic in St. Louis. There's just one that didn't take my insurance. So just to say that's an option for you healthcare providers to refer your patients to post-COVID clinics. Another great resource for me in this time has been Survivor Corps. So it's really a grassroots movement. So I get it right. So it's one of the largest grassroots movements, providing education and resources for COVID-19 patients, connecting them with medical and scientific research efforts, and helping with a national response. There's also a Facebook support group many of us are a part of, hundreds of thousands of us. It's now, last year, I think it was estimated there are 10 million in the US alone with long COVID. After Delta and Omicron hit, now this year, the estimates are up to 24 million. This isn't, just kind of outliers. And even if it were, it's important to look into why this is happening and what therapies are available. And I'm thankful that there is ongoing research, and we all really look forward to having more answers. So I know it's been challenging for healthcare providers to know what to do about a novel virus. But I definitely encourage looking at, I think Survivor Corps is a great resource. There are many others as well. They have webinars and links to updated research. One thing I found in my journey and many others with long COVID, many of the tests are normal. Many of the imaging, labs, it just seems that we have to dig a little deeper. And I've since learned some other things about autoimmunity, some other exposures that may be contributing to my symptoms. But COVID was definitely the trigger. I still battle fatigue, still have the dizzy spells and a lot of pain. But I think one of the scary parts was not knowing what symptom I'm going to have that day or what multiple symptoms. So each day brought on sometimes a new symptom I had never had before. So it was scary. I think one of the main things I've seen in the Survivor Corps group, patients have, people in the group have posted about doctors telling them it's anxiety or it's depression that's causing their symptoms. Well, many of us developed those things because of what these symptoms produce, right? But I would challenge that assumption that this all has to do with anxiety or depression. Those are things that definitely need treatment and they're real. But just want to encourage, continue to investigate. When I asked other members, what would you want me to share with a room full of doctors and healthcare providers? And a lot of them said just to listen. And long COVID exists. And just because tests are normal doesn't mean your patient isn't very sick. Sometimes we take a little more time, so you may need to take a little more time with us. And we're really, really thankful for those who do. I really believe we can get to a better place together as we all work together. But it's just really going to take more investigating. My hope as well is that others with post-viral illnesses, chronic fatigue syndrome, that those patients will also get help as we get more answers from long COVID research. So it's been an ongoing journey for me. I'm not healed yet. A lot of times people say, give it time, right? Well, there are many people who are 2 years, over 2 years into their journey with long COVID, and they're not getting better. Some of us are actually getting worse. So we're pretty desperate. I think it's important that we change the dialogue about who's at risk, because many of the people with long COVID were healthy pre-COVID. They didn't have any known, underlying health problems. Many of them were athletes. And so I know we are discovering new things about why that is. So again, I'm encouraged by that, but I think we need to be careful not to assume just because you're healthy, you don't need to be careful or you don't need to be vaccinated. I thought low risk, right? But getting COVID made me high risk for COVID. So then when I got COVID again in just a month ago, so end of April, I knew I was actually high risk. Thankfully, I had been vaccinated and had my booster. I don't even want to think about what it might have been like for me if I hadn't been vaccinated. And then the rest of my family who never had COVID before, they were all vaccinated except for my 4-year-old. My 4-year-old wasn't old enough yet to be vaccinated. He struggled with COVID for 10 days. It was really the sickest I've ever seen him. Even one night going to the emergency room because he was having trouble breathing, having those retractions. Thankfully, he started turning the corner and getting better. Then for a whole week after that, actually a few weeks after that, he continued to have a cough and needing an antibiotic. So it was very evident how vaccines were at work in my family. My husband, who was vaccinated, didn't even test positive and didn't have any symptoms. My 8-year-old, who was vaccinated, he had a bit of sore throat for a couple days and then he was fine. He did test positive. My 6-year-old never even tested positive. She had a fever one evening and then was totally better. So yes, the vaccines, at least for our family, and I know many others, because I've had so many conversations and talked with people who are vaccinated or not vaccinated. Even a dear couple I know, multiple ones where one of them maybe wasn't vaccinated and either didn't make it or had very severe disease. I know these are individual choices, but it was definitely the right one for our family to get vaccinated. It was still hard on my body getting COVID this time, just because of all the symptoms I've had post-COVID. But I'm really thankful and confident that the vaccine helped me through it, along with some other therapies. I'm thankful that our family as a whole made it through. But it was very evident to me that the vaccines were helpful. I'm also part of a group called Long COVID Kids. I think that's the other thing we need to change in how we talk about children and COVID, because they are also at risk of long COVID. We're seeing more and more cases of that in post-COVID inflammation. Even my 8-year-old had some of that 2 weeks after COVID. I think just having my genetics, just being more vulnerable to that. Thankfully, it didn't last for him. I thank God, and I thank vaccines for that as well. So I just encourage everyone, regardless of what, if you think that you're high risk or you're just very healthy and take care of yourself. I thought so too. I'm a dietitian. I know what things to eat and how to stay healthy, at least as best I could. But still, it affected me. It has been life-changing for me, and I just don't want anyone else going through that. I also want to encourage us to keep working on these vaccines. I'm so thankful for what we have, but I believe we can develop even better. That will be even more preventative, that can stop these cases of long COVID. So please, for all of the healthcare providers in the room, just continue to listen to us. Because when it comes to a novel virus, in some ways, the patients are the experts. You guys know so much more than we do about a lot of things, but I think we can really help each other. And just because it's new doesn't mean it's not true. I know many of you have worked very hard during this time and want to honor just the sacrifices you all have made, even of your own safety, to care for us. So thank you for that.